Welcome to the topic Parasitic Infections in the module Gastroenterology and Hepatology. By the end of this topic, you should be able to define parasitic infections, discuss the pathophysiology of parasitic infections, explain the clinical presentation of a patient who comes in with parasitic infections affecting the gastrointestinal tract specifically, outline the investigations in the diagnosis of parasitic infections, and finally, discuss the principles of management of parasitic infections. Let's get started. A parasitic disease, also known as parasitosis, is an infectious disease caused by or transmitted by a parasite. Many parasites do not cause diseases as it may eventually lead to death of both organisms and host. However, there are some parasites that carry on infecting. And parasites infecting humans are called human parasites. Some parasites like Toxoplasma gondii and Plasmodium species can cause disease directly, but other organisms can cause disease by toxins that they produce. Parasitic diseases include infections that are due to protozoa, helminths, or arthropods. For example, malaria is caused by Plasmodium, a parasitic protozoa. So the mechanisms of diarrhea production by intestinal protozoa are related to direct cytotoxic effects and ability to invade and/or effects of the immune response on the intestinal epithelium. There's no evidence that suggests that intestinal protozoa produce enterotoxins. Let's take a look at an example, Entamoeba histolytica. Mature cysts are ingested via contaminated water or food, and after excistation in the small intestine, trophozoites inhabit the large intestine and can either invade the tissue or are eliminated in the stools. Upon invasion of the host, amoebas are capable of killing immune effector cells by contact-dependent cytolysis, possibly by a calcium-dependent mechanism. All infectious agents in humans are parasites by convention, so parasitic diseases are defined as those caused by protozoal or helminths. For instance, Giardia lamblia has been shown to lack mitochondria and shown to contain ribosomal RNA sequences that resemble bacteria. These protozoa have been proposed to represent an evolutionary transition between prokaryotic and eukaryotic microorganisms. The classification of representative protozoa according to mode of transmission can be done as follows, where you can have enteric transmission, such as caused by Giardia, Entamoeba, Cryptosporidium, Toxoplasma, Cyclospora, and Microsporidia. Next would be sexual transmission, such as caused by Trichomonas, and arthropod transmission, such as Babesiosis, Plasmodium, Leishmania, and Trypanosoma. Other modes of transmission include Enteroamoeba and Toxoplasma, while Toxoplasma is the only pathogenic fecal-oral transmitted protozoa that has not been associated with gastroenteritis. Symptoms of parasites may not always be obvious. However, such symptoms may mimic anemia or a hormone deficiency. Some of the symptoms caused by several worm infestations can include itching affecting the anus or the vaginal area, abdominal pain, increased appetite, bowel obstructions, diarrhea, and vomiting eventually leading to dehydration, as well as having sleeping problems. Some of the most common signs of a parasitic infection include abdominal tenderness, dehydration, lymphadenopathy, iron deficiency anemia, having recurrent yeast infections, and also insomnia. So, how do you investigate this further? There are simple ways of investigating certain infections. One way to detect pinworms is to shine a flashlight on the anal area. The worms are tiny, white, and thread-like. If none are seen, check for 2 or 3 additional nights. The best way to diagnose this infection is by doing a tape test as shown in this slide. The parasitology test is a direct examination of the stool for ova and parasites in order to determine the presence of parasites and/or their eggs in the gastrointestinal tract. Direct identification can be done, and other examples of tests that also can be carried out include urine parasite tests, blood smears, as well as tissue infection tissues that are infected, and direct examination of these specimens. As for imaging, MRI is superior to CT scan in the evaluation of most CNS parasitic infections. However, here focusing more on the gastrointestinal tract, imaging studies have lesser value or use in this section. So what is the best treatment for parasitic infection? One may prescribe medications that destroy parasites such as albendazole and mebendazole. These medications are generally taken once to treat the infection. Anticestodal drugs such as praziquantel is a broad-spectrum vermicide that is used to manage infections such as cestodes called Tinea saginata, Tinea solium. Alternatively, niclosamide, which is discontinued now in the US, can be used to manage the above infections as well. Other than that, you may also use antihelminthic medications, which are drugs that remove parasite worms from the body. Only two well-recognized conditions in which surgical therapy is necessary for intestinal protozoal diseases, which are necrotizing colitis caused by Entamoeba histolytica or E. coli and complicated amoebic liver abscess. When it comes to surgery, indications for surgery in fulminant amoebic colitis include failure to respond to anti-amoebic drugs following perforation and localized abscess formation, persistence of abdominal distension and tenderness despite effective anti-amoebic therapy, and in the presence of toxic megacolon. So to summarize parasitic infections, we understand that these infections are caused by protozoal or helminthic infections in the gastrointestinal tract. We have understood the pathophysiology and causes, the common clinical manifestations seen in parasitic infections, what are the bedside tests that can be carried out, and lab tests which are useful in not only identifying the pathogen but also assessing the severity of dehydration, and finally, management, which can be divided into medical approach and surgical approach if there's complications caused by these parasitic infections. We have come to the end of this topic. Thank you for your time.